Yeah, we look at AI in two sort of paths, right? One is again doing more with less, and I mean, we see that if you've used ChatGPT for anything in your life, you see that it can help you do more with less, and I think that's only going to continue as you guys create more and more ways to give our clinicians tools to make them be able better at what they do, take their eyes off the documentation and get to focusing on the patient, on the care, on the that they need to give, right? Helping them do more with less. The other way that we really are excited about AI is, like many of you on this call, you're sitting on treasure troves of data. And we don't always know how to mine that data, how to look at that data, how to analyze that data to really show the world how much what we do matters to the healthcare in this country, right? We don't get the talk, we don't get to always have that spotlight to say that what we're doing in mental health is helping the system, helping reduce costs in healthcare, helping people get healthier, either in their physical. And I think some of that's because we just haven't really figured out how to harness the data. And we talk about Merakey, how do we tell our story? How can we really
Exactly.
tell the story? And dashboards are great, reports are great, but that's where the power of AI to really get in and tell us things about our data we didn't even know about, I think is really exciting for the future.